Welcome to The Invisible Killer, Superbugs and the End of Medicine, where we delve into one of the most pressing health crises of our time. In this video, we'll explore what superbugs are, how they develop, and the alarming rise of antibiotic resistance that is jeopardizing modern medicine. From common strains found in hospitals to the impact of agricultural practices on resistance, we'll uncover the complexities of this global challenge. Join us as we examine the urgent need for solutions before we reach a point of no return in our fight against these invisible threats. 1. What are superbugs? Superbugs are strains of bacteria, viruses, fungi, or parasites that have developed resistance to the medications we have long relied upon. These organisms evolve and adapt their defenses to survive against antibiotics, antivirals, and antifungal drugs. When infections caused by these superbugs occur, they become harder, and sometimes impossible, to treat. Picture a stubborn weed in a garden that refuses to die no matter how much herbicide you spray. Superbugs are much the same, with the potential to devastate human health by rendering our drugs ineffective. 2. How do superbugs develop? The development of superbugs is inadvertently fueled by human behavior, particularly the overuse and misuse of antibiotics. When antibiotics are prescribed unnecessarily or patients fail to complete their courses, bacteria are given the opportunity to survive and adapt. This survival of the fittest scenario allows them to develop resistance. Much like how athletes train to overcome obstacles, bacteria evolve defenses against the antibiotics meant to destroy them. This unintentional training ground is not limited to human medicine but extends to animals and agriculture, compounding the problem. 3. Antibiotic resistance is widespread. The World Health Organization, WHO, has identified antibiotic resistance as one of the greatest threats to global health. The statistics are staggering, with at least 1.27 million deaths annually directly linked to drug-resistant infections. This number is a stark reminder that superbugs are not just a medical curiosity but a deadly reality. These resistant infections can spread quickly, turning hospitals and communities into battlegrounds. It's a silent epidemic, with the potential to outpace the development of new treatments if left unchecked. 4. Common superbugs. Some superbugs have become household names due to their notorious impact. Methicillin-resistant Staphylococcus aureus, MRSA, is infamous for causing severe skin and bloodstream infections. Clostridioides difficile, C. diff, is known for causing life-threatening diarrhea. Carbapenem-resistant Enterobacteriaceae, CRE, and drug-resistant tuberculosis, TB, pose significant challenges in treatment. Meanwhile, Candida auris, a deadly fungal pathogen, has emerged as a formidable foe in healthcare settings. These superbugs are the villains in the story of modern medicine, each with unique characteristics and dangers. 5. Impact on modern medicine. The rise of superbugs threatens to unravel decades of medical progress. Many routine procedures, such as surgeries, cancer treatments, and organ transplants, rely on effective antibiotics to prevent and treat infections. Without these drugs, these procedures become riskier, potentially leading to catastrophic outcomes. Imagine a world where a simple cut or surgical incision could lead to an untreatable infection. This grim scenario underscores the urgent need to address the superbug crisis before it undermines the very foundation of healthcare. 6. Superbugs in hospitals. Hospitals, ironically, can be breeding grounds for superbugs. The heavy use of antibiotics in these settings creates an environment ripe for the development of resistant strains. Patients with weakened immune systems are particularly vulnerable, making infection control crucial. Poor hygiene practices and overcrowded facilities exacerbate the problem, turning hospitals into hotspots for superbug infections. It's a sobering thought that the very places we turn to for healing could become sources of untreatable infections. 7. Agricultural practices and resistance. The agricultural sector also plays a significant role in the rise of superbugs. Antibiotics are often used in livestock and farming to promote growth and prevent disease in healthy animals. This practice creates resistant bacteria that can spread to humans through food and the environment. It's akin to using a sledgehammer to swat a fly, with unintended consequences that ripple through ecosystems and human communities. Addressing this aspect of the problem is vital in the fight against superbugs. 8. The end of effective antibiotics. We stand on the brink of a post-antibiotic era, where even minor infections or routine surgeries could become deadly. The lack of new antibiotics and alternative treatments heightens this risk. It's a chilling thought that the arsenal of drugs we once took for granted could become obsolete. The end of effective antibiotics would mark a return to a time when simple infections were often fatal. This potential reality underscores the urgency of finding solutions to the superbug crisis. 9. Limited development of new drugs. The development of new antibiotics is fraught with challenges. It's a costly and time-consuming process, with limited financial incentives for pharmaceutical companies. Unlike drugs for chronic conditions, antibiotics are used for shorter periods, making them less profitable. This economic reality has led to a stagnation in antibiotic development, leaving us with a dwindling arsenal to combat superbugs. To overcome this hurdle, innovative approaches and incentives are needed to spur the development of new treatments. 10. Combating superbugs. Las Vegas, the entertainment capital of the world, is not immune to windy conditions. The city's iconic skyline features numerous skyscrapers that have been designed with wind resilience in mind. Engineers and architects use advanced techniques to ensure that these structures can withstand the strong gusts that sweep through the city. In addition to wind-resilient buildings, Las Vegas has implemented measures to protect pedestrians from the wind. Public spaces and walkways are lined with windbreaks and sheltered areas, allowing visitors and residents to enjoy the city's attractions without being disrupted by the breeze. This thoughtful approach to urban design ensures that Las Vegas remains a comfortable and enjoyable destination, even in the windiest of conditions.